Hello, I'm Sandra and I'll be presenting information on diabetes types and diuresis-inducing medication. Firstly, I will explain diabetes mellitus. This is an alternative name to categorize diabetes 1 and 2. In diabetes 1, the insulin beta cells of the pancreas, which synthesize insulin, are destroyed. This is often due to autoimmune disease whereby the immune system attacks those cells. Lack of insulin means that the blood glucose cannot be transported to the cells and will instead cause hypoglycemia. When glucose, the cell's main energy source, is not available, a secondary fuel source can be used. The liver will produce ketones from lipids. If ketone acids accumulate in the blood, ketoacidosis can occur. Type 2 diabetes is characterized by insulin resistance. This too causes excessive glucose in the blood or hypoglycemia, as glucose cannot enter the cell. It is often associated with obesity and also genetics. Increased glucose intake in the blood for prolonged periods of time can lead to loss of insulin sensitivity. In diabetes type 2, pancreatic beta cells can become destroyed or shrink when trying to compensate for increased glucose in the blood. Diabetes mellitus can lead to kidney damage. Damage can occur to small blood vessels, which in turn can cause damage to the kidneys, and this may result in kidney failure and inability to reabsorb filtrate. Blood vessels can tighten, thicken or swell up, and in the basement membrane of the glomerulus can cause excessive filtration due to impairment. Tubules or glomerulus may undergo sclerosis, where function of the tissue stability is impaired and replaced with connective tissue with loss to its special function. As the kidney becomes impaired, reabsorption becomes impaired, and water is not reabsorbed back into the plasma, causing excessive urine or polyuria. This then causes dehydration and excessive water intake or polydipsia. Diabetes insipidus is a condition whereby fluid regulation in the kidney is impaired. The kidneys use specific methods to enhance reabsorption of the fluids in the plasma. This involves the endocrine system and in particular ADH. ADH is used to increase water reabsorption and is synthesized in the hypothalamus and stored in the posterior pituitary gland. Diabetes insipidus can be caused by lack of ADH, which is commonly referred to as central diabetes insipidus, or resistance to ADH, which is referred to as nephrogenic diabetes insipidus. Brain damage can impair the ability of the hypothalamus to synthesize ADH, resulting in increased inhibition of water reabsorption. Nephrogenic diabetes insipidus can be caused by impairments of the receptors in the kidney, inhibiting the cascade to use aquaporins to transport the filtrate across. Polyuria is the result, followed by dehydration and polydipsia. So we have an image of a nephron here, and damage to the hypothalamus has ceased its ability to synthesize ADH. So we have no ADH in the bloodstream, and we can't create the cascade to use the aquaporins to transport the water across. So that's inhibited. On the other hand, we have ADH receptors inhibited, whereby the ADH will have no effect on the solute. Often people with various conditions such as hypertension require special management of fluid balance. In contrast, medications can seek to induce diuresis and are often used to inhibit water reabsorption. Reducing fluid in the plasma will reduce blood pressure, which is what the diuretics do. There are a variety of medications to induce diuresis. One in particular is the category of loop diuretics, which act on the loop of Henle of the kidney, specifically the sodium chloride and potassium transport system. Sodium chloride is inhibited as the diuretic medication binds to the protein carriers. As sodium is inhibited, the fluid remains in the filtrate. In normal mechanisms of the kidney, sodium would be transported to the plasma, with the solute following it.